Hello everyone, welcome to my YouTube channel. My name is Onesimus and we are on Onesimus the Fashionable Nurse. In this tutorial we are going to be learning about gingivitis. Gingivitis is an oral condition and I've moved with the dentist alongside me. He will be telling us gingivitis in full details. Everything you want to know about gingivitis he will be telling us. So let's listen to him. Doctor, you can come and tell us.
My name's Paul Lomokon, a public health dental officer. Today, I wanted us to share something about gingivitis, being one of the commonest oral health conditions in Africa, where people don't pay attention to their oral health. In our topic, we are going to look at some of the objectives. One, we are going to look at the definition. We are going to look at the types. We are going to look at the causes of gingivitis. We are going to look at the signs and symptoms. We are going to look at the treatment, possible treatments, and the preventive options that are available. To start with, by definition, gingivitis is an inflammatory condition of the gums that is majorly caused by plague. Plague is decomposed food particles mixed with bacteria that get adhered to the teeth. It is a sticky film. Therefore, as this bacteria invades the gums are going to start reacting to the bacteria by swelling. That's how we get this condition called gingivitis, or swelling of the gums. Let's go to the types. There are majorly gingivitis can be either acute or can be chronic, but there are other types of gingivitis according to the causes. According to the causes, we have hormonal gingivitis. We can also have drug-induced gingivitis or trauma-induced gingivitis. In hormonal gingivitis, we are going to look at pregnancy, where the pregnant mother's hormones are going to trigger general reaction of the body, including the gums. So the mother hence have developing gingivitis, a condition termed as a pregnancy tumor. So also in the hormones, we look at the adolescents in their active stages, and because of their lifestyle of not brushing, they also end up developing gingivitis. In drug-induced gingivitis, we look at patients on chemotherapy, patients on long-term treatments like antibiotics in treatment of tuberculosis or antiretroviral drugs. So let's go now and look at the signs and symptoms of gingivitis. In the first place, there's going to be swelling of the gums. Secondly, bleeding of the gums, either on brushing or on gentle touching of the gums. Also, we are going to get a bad breath, vascular litosis. There will be a bad breath because the tissues are decomposing. That's how we get bad breath. Also, the gums will start receding from the teeth. The roots will start to be exposed just because the gums have decomposed, and as they decompose, they get infected and reduce. That's what's called gingival recession. Also, we are going to on a as progression takes place, there's going to be loosening of teeth. Teeth become mobile. As teeth become mobile, a, a tooth infection abscesses can set in, and you develop a condition called a NUG or acute necrotizing ulcerative gingivitis. This is where you will find pus, abscesses within the gums, and general bad oral health as a result of this bacteria. Let's go and see how can we treat this disease, gingivitis. The most common is to do scaling. Your dentist will advise you to do scaling and polishing. In a acute necrotizing ulcerative gingivitis, you may not do the polishing because the gums are totally damaged. So there you can do the scaling, then the polishing comes later as the healing takes place. Also, antibiotics. We have to put antibiotics to kill out that bacteria that has caused the gingivitis. Then you have to use oral mouth rinses. For example, metronidazole mouth rinse. You can even use fluoride mouth rinses. All these help in eliminating the bacteria. So let's move to prevention. Prevention is always better. Treatment is more expensive and is costly in these cases of Africa. For example, in prevention, brushing your teeth daily. Brushing your teeth daily with a fluoridated toothpaste. Secondly, you have to do flossing, dental flossing. This is where you get a string and you use that string to clean in between your teeth. So this string will remove the food that gets in between the teeth, check that no bacteria remains there. Thirdly, we have to use fluoride mouth rinses. Fluoride mouth rinses, you can use it twice daily, morning and evening, or you can also use warm salty water. Warm salty water helps to eliminate the bacteria in the gums. Fourth, you need to go for you need to be going for dental checkups. As you go for dental checkup, your dentist can identify the disease in its initial stages, and then you are told to treat early. Also, you need to avoid overconsumption of sugary foods and beverages like the bread, like like soda. So these foods, as you consume them, it attracts bacteria to your teeth and damage your teeth. We are not saying you should not eat them, but eat them sparingly.
Thank you for watching. Please subscribe for more videos and like. And in case you want to share with me something, please let me know by putting it down in the comment section.